Breslau, German Empire, January 26, 1903. A 15-year-old girl arrives at the university surgical clinic with a face devastated by rhinoscleroma, a chronic granuloma-forming disease. Due to the illness, the patient had lost the cartilage in her nose, causing significant collapse and scarring. The reconstructive methods employed in this case marked a strange chapter of innovation in the field of plastic surgery. The case landed in the hands of Dr. Walter Kausch, a general surgeon who would later gain recognition for his contributions to pancreatic surgery. On examination, Kausch noted that the cartilaginous septum and upper lateral cartilages were almost completely obliterated. This meant that soft tissue alone could not restore the nose's structure. He needed bone, or cartilage, for nasal tip support. So he conceived of something no one had ever attempted before: transplanting the patient's second toe to form a new nose. By 1900, the idea of using a digit to reconstruct a nose was not itself new. In 1875, James Hardy of Manchester transplanted the tip of a finger to rebuild a young woman's nose. The technique was then revisited by Joseph Tunis of Philadelphia in 1897 with successful short-term results. Kausch took the next logical step, using a toe instead of a finger. But the real problem wasn't the donor site. It was how to keep that transplanted tissue alive when moving it such a great distance from the foot to the face. The answer lied in the waltzing flap technique, published just a few years earlier. First described by George Schrady in 1891 and later popularized by William Halsted in 1896, it allowed tissue to be transferred in stages by keeping it temporarily attached to an intermediate site before being moved to its final destination. For his patient, Kausch chose the palm of the hand as the temporary resting place. The first stage of surgery took place on February 12, 1903. The nail bed of the right second toe was removed and sutured to the surgically prepared base of the left palm, close to the wrist. The foot and hand were then immobilized together with a cast and allowed to heal. 4 weeks later, the toe was detached from the foot, and after 2 more months of being attached to the palm, it had established its new blood supply. On May 20th, 1903, Kausch completed the final transfer, suturing the toe into the nasal defect and again fixing the hand to the face with plaster. After 16 more days, the toe was detached from the hand and left to heal for several weeks, following which the toe was then surgically trimmed and inset under the nasal skin. The outcome was groundbreaking, but not enduring. Over time, the transplanted tissue contracted and thinned, and the loss of a digit was a heavy price. Soon after, Friedrich von Mangold's introduction of rib cartilage grafts rendered such digital transplants unnecessary and revolutionized nasal reconstruction. Still, Kausch's operation remains a testament to early surgical imagination, a fleeting moment when plastic surgery dared to take one more step forward, guided by the pioneers of plastic surgery. To learn more about this story, visit Pioneers of Plastic Surgery on Substack.